my menopause, I said, this shouldn't happen. This is not natural. The body, as an osteopath, you put the body, and as a naturopath, you put the body on the path to healing. So you remove restrictions from healing instead of suppressing signals from the sympathetic nervous system or any tissue that is saying, I need help. Instead of squashing that, suppressing that signal from the body, you put it onto the path in order to not present that signal, not communicate in that way. It's communicating deficiency. It's communicating imbalance whenever there's an issue. Illness is deficiency and imbalance. So my own menopause inspired me to write the book, and my research showed me that with Kristen Hawkes, who's an anthropologist, an American, who is the person who first spoke about the grandmother hypothesis. So why do women live long? Why do we live longer than chimpanzees? What is menopause for? Well, menopause is for, we're not supposed to crumble and die. Chimpanzees and apes keep having babies in their 50s. They have babies till they die. So it's very nutritionally expensive to have babies. Hence, menopause, we evolved to have menopause as humans so we could live these long, fruitful lives where we can take care of our grandchildren, study art, do all the things that we couldn't do while we were fecund and raising children. So that is what inspired me to further. She spoke about Fernand Labrie, who did some papers in the 80s, put out some papers in the 80s about DHEA, how DHEA is where 85% of the sex steroids are synthesized via the adrenals, and that the ovarian estrogen and ovarian progesterone and ovarian testosterone is only necessary for fertility. So if you're not fertile anymore, you don't need them anymore, except women have always been seen as simply vessels for procreation, and all their health issues, medicine has always, I call it the medical male gaze, has always focused on a woman's reproductive apparatus as a source of all illness. So that mindset in the medical world continued on after the discovery and synthesis of estrogen in the 20s, further on into the 30s. They only discovered cortisol in the 20s. So they assumed that we would crumble and fall apart if we didn't have this stuff once we stopped bleeding.
So you're in martial arts. You are naturopathic medicine, osteopathic, and where's this modern medicine? Where's our disconnect? Because in your particular practice, you connect with your community, your patients, much more than. And again, in modern medicine, it's a pill, a shot, or a surgery.
Yeah.
But in the naturopathic, osteopathic world, there's a little bit more integration.
Yes, definitely. So for me, especially the problem with, I'm kind of the doctor from 150 years ago who looks at your tongue, who looks at the skin. I mean, as an osteopath, obviously, I don't have an online patient in front of me, but I make I get the information that I need to know if their tissue is congested in certain places, and why would that be, with my very long questionnaire. The disconnect comes that you're trying to, medicine is palliative care. As I said, it's suppressing the signals from the body. The body is very good at communicating that something is not right. And a symptom is a communication. So osteopathically, naturopathically, we try to figure out where that signal is coming from and why, and remove the obstacle to healing what that signal is trying to say. So for instance, depression. Depression is related to low cortisol levels. Bipolar states are related to not enough brain T3. I mean, and the high-fat carnivore diet, 75% fixes almost everything, because you are giving the brain adequate nutrition as in the form of ketones. You're removing inflammatory foods, which are carbohydrates, which can make people crazy. blood sugar issues, reactive hypoglycemia is basically a death state. Your body will tell you you're dying. So you'll have cravings, which are because you're having too much of an insulin swing up and down. And people will instead eat sugar pills. So, I get people's blood sugar balanced so they don't go crazy.
So we're in essence, over the last 50, 100 years, we've again, maybe even longer, how in the modern world, science has sort of pushed this plant-based diet on us, which likely has contributed significantly to the growth of the diseases and the challenges we're
Absolutely.
suffering from. And tell us how you sort of have worked your magic into sharing why fat and butter is so important for not only women but men and all of us.
Yes. Okay. Well, the butter thing came from me trying to, I try to make things very visual and easy to understand. So if you're trying to explain to somebody 80-20%, 80% fat, 20% protein, I came up with 1 stick of butter and 1 pound of protein would get you to an 80-20 range. So that's why the stick of butter thing came around. It could be tallow, it could be fat trimmings. It doesn't have to be butter. Any saturated animal fat, not avocado oil. Can't make hormones out of avocado oil.
Mm.
Has to come. We can only make hormones out of animal fat, which is cholesterol, which is at the top of the hormone cascade. And as far as history is concerned, we used to use lard. I think the pie chart for what a person, the healthy diet in the 1940s was a circle. So it was a lot of meat, a lot of fat, a certain amount of protein. They had it even right around the war, right around World War II. It
Right.
wasn't this tiny pyramid with a tiny amount of meat on top. But people those days were doing a lot of manual labor. So you could understand a certain amount of carbohydrates that might come in handy for somebody who's a lumberjack or farming huge tracts of land physically. Right now we have machines and we don't have as much manual labor. I really like going back to Gary Fetke's wife, her papers on the origins of the anti-meat propaganda, which basically started with sickos, Kellogg's and
Mhm.
Graham, the graham cracker and Kellogg's cereal, who saw meat as because it gives you hormones, made you want to masturbate and have sex. And that was bad because of the Victorian era. So the more grains you eat, the more you don't want to have sex.
Mhm.
And that's really where that came from. McGovern's diet czar he was a Seventh-day Adventist. So it's really since the 80s that all this Harvard Chan, they're run by Seventh-day Adventists who don't want us to eat meat.
So it's a controlling world in essence. I always say it's a few masters want to keep the masses meek,